yesterday. Angelina Jolie made news this week when she announced she had a double mastectomy that was because she carries a gene that makes her 87% more susceptible for getting cancer than normal.
Yes, the surgery cut her risk now down to 5%. Doctors are saying that the procedure is saving lives, but for some women, the thought of having such a drastic surgery is pretty scary for a number of reasons.
We caught up with one woman in Albuquerque who has gone through the process and credits it with saving her life. Here's News 13's David Romero with that story.
3 years ago, Shana Sanchez discovered a lump in her breast. Immediately went to doctors who diagnosed it as cancer. She went through chemo and had a lumpectomy, which removed the lump and took care of the cancer. Then in February, cancer showed up again, this time in her other breast.
I made my doctor a promise, last time for my first cancer. He's like, you don't have to do a mastectomy, but there's a good chance it could come back because I'm BRCA positive and I have a cancer gene. And if it comes back, will you promise you'll do it? And I was like, yeah, we'll do it if it comes back, because I didn't think it would.
But it did. And doctors at Loveless Medical Center say because Shana had a family history of cancer and tested positive for the BRCA gene, the double mastectomy has improved her chances to live.
The risk reduction is greater than 90% if you have this surgery.
According to recent studies, women who test positive for the BRCA mutation have up to a 50% risk of developing breast cancer by age 50 and a 64% chance of it turning into a second breast cancer. That was also the case in Shana's family.
My mom's actually had breast cancer 3 times, and her third cancer, she was like, I'm just going to take them both out. And when I saw her and how strong she is, I was like, I could do it. And you got to have faith. You got to pray. I mean, God will bring you through it.
Doctors say testing for the BRCA gene is a simple one and can be done through drawing blood or a cheek swab in the mouth. Either way, it is crucial.
If a patient has the genetic mutation, which places them at an 80% risk of getting a breast cancer, I would recommend that they get the preventive surgery.
Get it checked out. Get it checked out. Don't be scared. I mean, it's not a death sentence. You're going to be okay. I mean, I'm fine. I feel good.
That was News 13's David Romero reporting. Shana had her double mastectomy in March, and as you can see, she is feeling pretty strong. Just a short 2 months later, she is planning on having the reconstructive surgery coming up in a few months. Now, the BRCA1 gene not only tells if a woman is susceptible to breast cancer, but ovarian cancer too. And as an alternative to the mastectomy, women can also get drug therapy, but studies show the mastectomy significantly reduces their overall risk.
It's great to see Shana being so courageous and at the same time with such a positive attitude.